John of the Revelation Health Center. If you're watching this link, you've received it from our office related to posture exercises. So what I'd like to do today is coordinate posture with the spinal curves and restoring those so that it improves the function of your brain and eliminates your symptoms, whether your symptoms are in your shoulders, elbows, wrists, or whether they're in your hips, knees, feet, possibly your lower back or lower neck. They're all related in the big picture to posture. I refer you back to the handouts we've given you that detail exactly why that's happening. So here we go. The first one is a chin tuck, where you take your finger and you lightly put it on your chin, and now you move your head back like a duck, is how I describe it in the office. So you don't want to be here and you don't want to be here. You want to be level with your chin. So now when you do that, now you want to extend your neck. So the wrong way of doing it is rocking your skull. You do not want to rock your skull. You want to chin tuck and then extend your neck and back. And you want to get to the point where you're looking straight up. And a lot of people that have difficulty with this, it's because your head is so far forward that it's restricting in range of motion. And as you do this exercise, it can hurt a little bit. So we want you to do it to the point where just short of pain. We do not want to increase the pain in your lower neck, but we want you to progressively increase the range of motion, which means you might have to go through some difficult stretching in the neck. Okay, so the first one again is chin tuck, and you extend the neck, keep the skull locked, and you're just looking straight up with the chin tuck. Okay, the second one is you want to increase the range of motion using rotation. So you rotate to the right and you rotate to the left. And you do it to the right and you do it to the left, just like that. And the next one is the most important one, because if your head cannot laterally turn to the right or laterally flex to the right or left, then it indicates you have a forward head posture. And that's from all the biomechanical doctors that have done studies on this for years and years. Okay, so you do a chin tuck always, and now you want to tip your head to the left and tip your head to the right. And doing this is incorrect, or doing this is incorrect. So I recommend that you do it in a mirror to start with. And if you do it in a mirror until you get the feel, and I just place my finger here again just to make sure that my chin is tucked and my head is backwards as I do this. So when I first started the posture work a year and a half ago in my office, my lateral flexion was here. And I was 20 degrees, and now look at where I am. I'm down to 65, 70 degrees, and that's where you want to be. On the lateral flexion, that is 65 to 70 degrees, is what we would consider normal range of motion. It indicates you have a healthy curve in your neck and that you are not compressing or irritating any of the nerve roots, and it improves the function of nerve stimulus into your brain. Okay, the fourth exercise is called the rainbow. It's where you stick your thumb out like this. And so as you stick your thumb out, okay, you follow the thumb with your eyes. So you lift your arm and you go up on a big arch. And then you come down and your tummy is forward the whole time. And I am looking at my thumb. And then you come back and you do this, okay? So you come up, you go down, and you come up, and you come back. Okay, you follow it up, and you want to lay your cheek on your shoulder as you go back down. Okay, and you come back. Now, some people can only get to here because their neck is so stiff and so tight. And when we recapture your posture, you'll slowly but surely increase your range of motion, where your head is just following and your eyes are following, and you're coming back. Okay, so the last exercise is a fairly basic exercise for many other types of stretching, where sitting does what to us? It flexes us and it internally rotates us. So you want to externally rotate your arms with your palms pointing towards the ceiling. You want to do a chin tuck, and then you pull your shoulder blades together. You're lifting, and here you do not want to see your arms. So your chin is in a tuck position. You can't see your arms because they're behind your line of sight. And when you get up to the top, then you stretch even a little more. And then you do a couple breathes in and out. And as you stretch, you can just feel that lengthen your entire spine. And then the last one, which is an optional one, is where you lay on your stomach and you literally do the Superman or Superwoman, where you arch your back, keeping your chin in a tucked position. If the floor was right here, you would arch and you would chin tuck, and then you would hold it for 10 to 20 seconds, and then you would relax. So those are the 5 or 6 exercises for posture rehab. Now the other thing is most of you who are in the office will recognize these. So these are our head weights, and head weights activate the cerebellum, which is the part of the brain that's responsible for posture and coordination of movement. So what we'd like you to do is wear these head weights for 20 minutes a day minimum, and then we would also like you to do your exercises with them on. So here I go. Okay, here's my extensions, here's my rotations. Okay, here's my lateral flexions. Okay, lateral flexion. Here's my rainbow, where I go up and I go down and I come back. Good. And then here's the external rotation, and reach for the sky, and then stretch when you get up there. These head weights, you have to initiate yourself into them very slowly. For the first 5 days that I put them on, I had deep, boring pain in the muscle nerve junction of my lateral head, my TMJ, and my suboccipital muscles under the skull. So what happened was the concussions and the whiplashes were so injurious to my neck that it took at least 5 days of waking up those nerve muscle junctions. And as I progressed over the first 2 months, I started adding weight. Most people have 2 pounds in here, right on the middle of their forehead. I've brought myself up and graduated to 4 pounds. So every time the head gets activated to the point where it's too easy, we're going to give you another pound. So 4 pounds is the goal, and you want to do 3 sets of 10 at least once a day, hopefully twice a day, and remind you to wear your head weights for 20 minutes a day, building up to that within the first week or 2. Thank you very much. Enjoy your rehabbing and recapturing the function of your brain and your spine.